Hello everybody, and a very warm welcome to this year's State Summer School of Ultrasound. On behalf of Sono4U, we'd like to welcome everybody in the audience, our partner universities, and everybody who is watching our live stream. We are Esther and Lisa, two tutors of Sono4U Graz, and we guide you through the program the next days. Especially, we would like to welcome our guests of honor. First of all, the Vice Rector for Teaching and Studies, Dr. Sabine Vogel. And from Mides, Max Fleecer and Stefan Kodovic. Frau Doktorin Sabine Vogel will now say a few words to us.
Good afternoon. My name is Sabine Vogel, and as a Vice Rector for Teaching and Studies at the Medical University of Graz, it's a pleasure for me to welcome you here. Well, it's a special event, big size, as we can see. And this late summer school is composed and organized by Sono4U, as you all know. What we noticed in the last summer term was that how important interaction for all of us is, and the direct communication we needed, you can say. This is why this event happens as a hybrid model today, with live stream for the people who are at home and here at the medical campus. The Medical University of Graz supports this event and this initiative because peer-to-peer learning is a very important part of the learning process. You all know that. Currently, 40 students are supporting and contributing to the project voluntarily. This is an amazing number that makes us really proud, I have to say. But we noticed also that we have to implement sonography in the curriculum better, what means that it has to be an integrated, substantial part of the curriculum, the diploma for human medicine. This is why the Curricularkommission Humanmedizin decided to enlarge the scope of sonography as well in the curriculum, and this takes place already in this winter semester. What does that mean? That means the curriculum on the one hand and this great offer for you on the other hand. So it's a complementary offer for you students. What can you expect in the next 3 days? It's, knowledge transfer for you in the use of ultrasound in general practice. And I'd like to remind you to follow strictly the hygiene requirements, to spend an inspiring and stay healthy here at the medical campus. I wish you all the best. Thank you.
Thank you so much for your kind words. This event would have not been possible without the generous support of our sponsors. First, a big thank you to the ÖH of Medical University Graz and the university itself for supporting us within this event and throughout the whole year. But also, we'd like to speak out a big thank you to all the rest of our sponsors. Those are the Forum of Junge Radiologie, die Vorarlberger Landeskrankenhäuser, die Oberösterreichische Gesundheitsholding, die Raiffeisen Landesbank Steiermark AG, and also Conventa, who's doing our technical stuff and who's doing our live stream, and especially Mides. Mides provides us with the ultrasonic devices on this weekend, but they also provide us one machine throughout the whole year for all of our courses, trainings, etc. We would now like to introduce you to Max Fleecer, who will say a few words about the company.
Hello, very warm welcome also from my side, and my name is Max, and I really like to welcome all of you on behalf of Mides. And yeah, I think in the meanwhile, we are here for the 7th year, I guess. So as everybody see, this event will take a lot of likes also on social media and on YouTube from home from all these people. This year again, we've chosen the same portfolio as the last couple of years. That means we've chosen ultrasound machines from the very low segment, so means entry units with, I won't say poor quality, but you really have to look, especially really carefully to see what you want to see. Up to really high-end machines like this one, which is really good in detail. So, as you can imagine, even in these, let me say, extraordinary times that we are living in, it was quite tough for us, even logistically, to bring such many units here. But we are really happy to be part to support all these prospective doctors like you are. And yeah, we are really happy. So to keep it short, I just want to wish you a lot of fun on this weekend and also be safe. And thank you very much.
For your words. Thank you very much for your words. So this event was organized by Sono for You Graz. We're a student initiative consisting of around 40 tutors. We'd like to emphasize you that we're all doing this in our free time. We're not getting paid and we're not employed by the Medical University of Graz. It's just our passion for ultrasound and the wish to carry this knowledge further that keeps all of us working for this. Sono for You was founded in 2013 by a group of enthusiastic medical students. 2 of them are going to be among us this weekend. Dr. Simon Orlob, who will do an introduction on Sono Basics later this evening, and Dr. Niklas Schönecker, who will do the Sono quiz on Sunday. Without the dedication of you and your colleagues, all of this would have not been possible. So thank you very much. Furthermore, we'd like to welcome one of our alumni who's currently running around, and we can't see him right now, but a warm welcome to David Purkerthofer as well. Most importantly, though, we'd like to speak out a big thank you to the whole entire team of Sono for You Graz for making this event possible and for all of their contribution. So thank you all very much. Besides Sono for You Graz, there are many other ultrasound student initiatives around Europe, and we're very happy because we are very well connected with them. Students from Linz, Vienna, Innsbruck, Mannheim, Magdeburg, Hamburg, Freiburg, and Aachen are with us this weekend through the live stream. We would now like to say hi to them and welcome them here in Graz. Oh.
Hört man uns? Hallo, hallo, hört ihr uns? Hört ihr uns in Graz? Hört man uns? Okay. Ah ja, perfekt. Es ist alles ein bisschen zeitverzögert. Herzlichen Dank an die Grazer für die Organisation der Late Summer School. Vielen herzlichen Dank. Danke, dass ihr das für uns organisiert und dass wir alle daran teilnehmen dürfen. Ich selbst durfte letztes Jahr persönlich vor Ort sein und habe es echt genossen. Es waren super interessante Vorträge und ich habe echt was mitgenommen. Dieses Jahr ist die liebe Loa von uns vor Ort. Liebe Grüße an die Loa. Es ist alles ein bisschen Und ja, wir freuen uns auf spannende Vorträge, interessante Vorträge mit vielen internationalen Doktoren und Ärztinnen. Und ja, wir verfolgen das alle live hier im Hörsaal unter Hygienevorschriften und sagen liebe Grüße nach Graz. Dankeschön. Liebe Grüße an Elora. Und
gut, dann hallo und Servus stellvertretend aus Wien. Ich kann mich nur anschließen. Also wir bedanken uns auch alle sehr für diese tolle Möglichkeit, dass wir uns auch in diesen Zeiten alle vernetzen können und für die Möglichkeit, uns da auch weiterzubilden. Wir schauen alle aus Wien brav von zu Hause aus zu und freuen uns sehr auf ein spannendes Wochenende mit euch.
Okay, jetzt geht's wieder. Will sich noch jemand vorstellen oder kurz Hallo sagen? Okay, so enjoy the weekend and have fun.
Seems like they didn't really want to talk with us, but we still hope that they're going to have a nice weekend.
Due to COVID-19, it was uncertain until recently if this event could take place. But we're glad it can, so you have the opportunity to practice ultrasound. Nevertheless, it's really important that we follow the hygiene rules. We sent you them via email, but I will repeat the most important ones. Please cover your mouth and nose with a mask every time you're not sitting on your assigned seat. Please avoid touching your face.
Hallo aus Freiburg. Wir sind 4 Studierende vom Studiz, vom Studierendenlernzentrum der Uni Freiburg.
Okay, jetzt geht's wieder. Will sich noch jemand vorstellen oder kurz Hallo sagen?
Aus Freiburg kann ich was sagen?
Ja.
Hallo, hallo.
Okay, so enjoy the weekend.
Hallo, wir sind eine Gruppe aus Linz, wir sind Unisono Linz, wir sind eine Gruppe von 7 Studenten und Studentinnen und freuen uns auf ein interessantes und spannendes Wochenende voll mit Sonographie. Schöne Grüße!
Okay, ich glaube. Okay, gut.
Viele Grüße auch aus Hamburg. Bei uns ist es auch so, dass wir alle von zu Hause schauen. Vielen Dank, dass wir jedes Jahr dabei sein dürfen. Wir hoffen auch, dass das so weiter bleibt und dass wir vielleicht nächstes Jahr auch wieder eingeladen werden. Aber jetzt freue ich mich erstmal auf dieses Wochenende. Ja, und viel Spaß uns allen.
Schön, dass ihr dabei seid. Okay. Can you change back to our presentation?
Ja, ich bin Simon aus Magdeburg. Mit mir sind 11 negativ getestet, andere Studenten hinter mir. Und ja, wir freuen uns jetzt erstmalig dabei zu sein und hoffen auf ein spannendes Wochenende.
Ganz liebe Grüße aus Aachen. Ich bin Gabriel vom Arbeitskreis Notfallmedizin. Wir sind auch einzeln zugeschaltet, direkt aus dem Risikogebiet und freuen uns total. Ich wollte nochmal Danke sagen. Wir haben uns letzte Woche bei einem eigenen kleinen Sonokurs ein Video von 2019 von Herrn Feigl ausgeliehen. Das kam super an. Wir freuen uns auf die Version 2020.
Perfect. Thank you so much. Okay. Good. Now everybody said hello, and we're very, very happy that they're here with us via live stream. I'm just going to repeat the corona rules because they're really important this year. As I said, please wear a mask every time you're not sitting on your side seat. Wash your hands regularly, avoid touching your face, and please keep distance to others. Even if you have only mild symptoms such as cough, headache, or mild fever, we ask you to stay home until you recover. But nevertheless, that's really important, but now we get back to the more pleasant part. Esther, what's the program for the next days?
Thank you, Lisa. I'll give you a short overview now. For today, we'll start with some introductory lectures, and at the end of this evening, you will have the opportunity to try ultrasound yourself in your own group. And on Sunday, we will finish off with a Sono quiz as a little repetition. We would now like to express our gratitude to all of our speakers. They share their knowledge and experience with us students. They do this on a voluntary basis and in their free time, which is just unbelievably great. So please, a big thank you to all of the speakers. This year's topic of late summer school of ultrasound is the use of ultrasound in general practice. So it fits perfectly that our first speaker is a general practitioner in Gamlet's, Styria. He's been using ultrasound in his daily life for many years now, and we're very happy to have him here tonight to share his experiences with us. So please welcome Dr. Peter Sigmund.
Das geht. Du, ich halte es so. Good afternoon, dear colleagues, young colleagues. I'll start my lecture with a kind of provocation and a time near vision. Physical examination of the patient without sonography is incomplete. So I'm very happy that the Medicine University will increase this topic on all the students. Sonography is not a technique in addition, but an integral part of physical examination. That's the message I want to bring you this evening. There are valid scientific data that the use of sonography in general medicine, in family medicine, is very useful. And our colleague Ignatius Fickert lined out these data in his thesis. Ultrasound assisted examination has a higher sensitivity. And you have findings which require immediate treatment. The examination time is very short if you do it regularly. And this disproves anybody's claim that there is no time for sonography in his or her daily schedule. And this is also my experience. You can imagine I have a practice, 100 patients every day enter my practice, 30 patients I see face-to-face front of me, and 2 to 5 patients of this 100 will need a decision with an imminent therapeutical diagnostic question. And it is possible to do sonography in these cases when the patients need it really. Point of sonography has faster diagnostic results, is cost-saving. Our insurance company should hear this also, and improves the patient outcome. And now let's have a look at the vocational theory of general medicine. I'm very happy that you have general medicine this time on your topic, and we have to look a little bit at the vocational theory. We have unfiltered patients population. Everybody can come to us, and we have a selection function. And this means that we have a low prevalence range. low positive predictive value of diagnostic tests. In primary care, severe illnesses and pathological findings are less frequent. So we need to increase our diagnostic mindfulness in order to avoid overlooking or to rule out serious processes. In 74% of the cases, a conclusive clarification of symptoms is not possible. Many patients come with the feeling of illness, but it is not every time possible to give an undoubtable diagnosis. And this is now the very task of general medicine, to find out the decision whether we wait for spontaneous healing, allow the natural course of a disease, or we intervene therapeutically. And this very task of general medicine was first published by our honored teacher and Austrian researcher, Robert Norbert Braun. Considering that all, you can imagine that sonography can improve our position significantly. We have, in many cases, changes of the management before and after sonography. We avoid referral to centers or to CT scan. And it narrows down the differential diagnosis in almost cases. And on the other hand, in nearly 10%, you get out new diagnosis, tentative diagnosis by doing sonography. I will show now several examples how sonography can be implemented in your daily routine. So you come with me into my practice now, and we have such a day working with me and going on house visit and have a look now. So this was the theory. It is very important to find out these cases who really necessary to be treated, and giving time for those cases where we can wait for the natural course and allow the healing by natural methods. Call from the old people's home. Patient has no urine. And the question is, does this patient cannot produce urine? Does he suffer from oliguria, or isn't he able to void the bladder? One look on the bladder, and you have you are sure you know what's happened here. And this looking at the bladder, you know, in the old people's home, in the nursery, sonography can also be carried out on house visits. Nurses do this diagnostic called bladder scan, and we also engage to do weaning from the permanent urinary catheter. And if we take away the catheter, we have to look if there is an urinary obstruction. I go every day, every second day to the nursery and look if the patient is able to void again. So it's possible to wean from permanent catheters. Without sonography, you have to wait for a severe urinary obstruction, and that's painful for the patient and not very sensible. Upper abdominal pain. With sonography, you can detect or rule out several pathological findings, overall the symptomatic cholecystopathy. Sonographic Murphy sign is to perform palpation with the probe. We could say ultrasound-guided palpation. We will find it a second time also. That's very helpful. You palpate with your fingers, and afterwards you palpate with the probe. And yes, okay, it's the gallbladder, and you are you can insert it. Patient with shortness of breath. Very often situation, and again, we have to distinguish between bronchopulmonary disease, cardiac congestion, pulmonary infiltration, or the seldom pneumothorax. As we learned it over many centuries, percussion and auscultation have a very low sensitivity and specificity. And so ultrasound is really a great help. You see the comparisons, especially when there is fluid in the lungs, in the pleura. Sonography is much higher sensitive than X-ray. And we can save X-rays by doing sonography. Pulmonary sonography is gaining importance nowadays. And now we have a look at the time. Since a half a year, we have to establish a very new kind of medicine. This is the entrance of my surgery, and there I check the patients having now symptoms of cough, of infection of the upper airways, and pulmonary sonography is a valuable supplement to the diagnostic also of COVID-19. Physical examination should be in a very short as possible time. You know, we should be less time than 15 minutes near the patient. And you need useful diagnostic instruments for that. It is the pulse oximetry, the CRP testing, and the portable sonography. With these tools, I can make the situation more sure. COVID-19 is a pulmonary disease, and so is lung imaging very essential. We have to find out the pulmonary involvement, and it is found that COVID-19 affects the lower and peripheral areas of the lung. So it can be seen in the ultrasound early. And it is early in the course of disease, sometimes earlier than the patient gets shortness of breath. So it is possible to estimate the extent and the progression of the disease, and to make a triage which patient can be cured at home and which patient has to be admitted to the hospital. This triage function, this is also a very important function of general medicine. We have typical pattern if there is a lung infiltration, and it is very useful to have portable scanners. So I need this patient not to give in my deeper areas of my surgery. My personnel does not get in contact to him. I am alone with him, and I do it with portable scanners. And these scanners should be easy to be cleaned. So I'm very hygienic also. After having scanned the lungs, it's very useful to have a look at the heart. Das mit der Film geht jetzt nicht an. Kann man nochmal? Okay, to have a look at the heart from a subxiphoidal view, you can see at the pericard, the atria, the aortic valve, and the liver veins. And so you have a rough overview over the cardiac function. And these two scans, the lungs, the thorax, and the heart, is also nowadays necessary in emergency medicine. Every patient with breathlessness, with shock, we have to look what's about the lung. And if you imagine, in former years, I did 20 years emergency service in the ambulance. You had only the anamnesis. When a patient was wheezing, you had only the anamnesis. And now you can make a fine differentiation. What is bronchopulmonary obstruction and what is cardiac fluid congestion? And every time when fluid is in the lung, when infiltration is in the lung, you can see it very easily. So it's a very great help for emergency medicine also. Legs are often not equally thick. This depends on constitution, orthopedic alterations, fluid accumulation, and the veins at all. To exclude venous thrombosis, it requires sonographic imaging. That's every day's work. We have to exclude venous thrombosis. You know, the laboratory will not help us very much. We need an imaging. And then the post-operative patient, you see the young operated knee. What is traumatic swelling? What is hematome? What is edema? And what is venous thrombosis? And with this compression sonography, you are very clear and very quick. And it goes in my surgery when I do the wounds fresh. I have a look. What about the veins? In general medicine, often arises the question, what is somatoform psychological? What is functional? What is a structural disorder? For example, this school child was claiming recurring pain. In my surgery, at the exploration in my surgery, the boy was free of pain. But he still claimed recurring pain in the morning before going to school. Every day in my practice, he has no pain. What's the matter now? Is it a kind of school anxiety? Is it a psychological problem? Okay, you see the pelvis, you see the renal pelvis, the congestion of the renal pelvis, a sign of hydronephrosis. This was the cause why this boy in the morning didn't like to go to school. And we can say in every febrile urinary tract infections, patient has a urinary tract infection, has fever, or signs of infection in the laboratory, high CRP, it requires sonography in order to rule out kidney congestion, because this kidney congestion would call for immediate urologic intervention. We have a lot of urinary tract infections. And if the patient has fever, you need an ultrasound. If you don't have one, you have to transmit him to the hospital. Lower abdominal pain, the organs of the inner structures of the inner genitals, so the urinary organs are well represented with sonography, especially if they are swollen, if there are cysts, if there are tumors, you can see them very well. And also orthopedic causes of abdominal pain, so to speak, the musculus psoas, can also be detected by ultrasound-guided palpation. That's very frequent. A lot of women are treated with adnexitis, and very often it was the musculus psoas. Transducer pressure on psoas triggers the characteristic pain, ultrasound-guided palpation. I am coming from the southern Styria, you know, Burschenschaft, winery, funny people, vivid people, red-faced people, high cholesterol, hypertension, obesity. But who of these persons will develop atherosclerotic disease? Not all, but who develops? And that's fine because the carotid arteries and the aorta are well accessible with ultrasound. And then I can see this patient has atherosclerotic disease, the others none. And we are also able to screen for aortic aneurysms, and we should screen it, men aged over 65 and men and women with vascular risk factors. Also, the thyroid gland has a very good sonographic accessibility. You can find many pathological alterations, and they have a high prevalence, especially the low function of thyroid gland. It's very common, very frequent. All things which are frequent in population should be guided and diagnosed by general medicine, because there are so many people. The specialists are not able to see all these patients. But we have this high sonographic sensibility affords our high responsibility, because not all pathological findings require an intervention. And so these initiatives, choosing wisely in America, smart decision in Switzerland, klug entscheiden in Germany, and gemeinsam gut entscheiden in Graz in Austria, these are initiatives to avoid overdiagnosis and overtreatment. To say in German, wer viel misst, misst viel Mist. So we have to be careful. We have to be careful, and pathological findings do not always require further investigations and further interventions. Anyway, every time it's worth to take aim with the transducer. So many situations in general practice. A man is working in the garden in the evening, he feels some swelling. Oh, well, what is it? You have a look with your probe on it, and see there is something in it. You make an incision, take the pincette, okay, it was important this. A patient comes, he has in the axle swelling, pain, inflammation. Is the abscess ripe for incision? Yes, it is. So every time I take the knife and I want to make the incision, I look first, what is under this tissue? Where will my knife go? Where are the vessels there? What is the tissue like? And I'm very safe, and it makes my work more safe. It's necessary to integrate the sonography well into the practice workflow. Ultrasound device should be near your working place, so to speak, near the blood pressure monitor. Avoid ways, unnecessary distances, no delays. At the beginning, in my practice, I had a separate room for sonography. Every going there, okay, then the 6 minutes we read before are not possible. This sonography machine has to be really at the place, talk to the patient, physical examination, sonography. This is one line, and you are very quick, and then you use it every time, and you get experienced anymore how more often you use it. And I think you all, if you work in the hospital in the next years, you won't go to the sonography room. You will have your probe with you, and your monitor will be your smartphone. And so sonography will be the same examination tool like the stethoscope. Sonography in Austria and abroad. Since 2015, sonography is implemented mandatory in the training for general medicine, and you can make perform this certificate of sonography from the Austrian Doctors' Chamber. Having this certificate in some provinces of Austria, this sonography is also billable for health insurance. It's fine for you, and for this weekend you are now here. There is a very steep learning curve with sonography. There is a steep learning curve for fluid detection. Everywhere there is fluid congestion, fluid obstruction. You see it very easy. You have one look and it's here, okay? and it is also in the transthoracic ultrasound. You have very soon the feeling that you have learned it very quickly. It is an imperative to refer all ambiguous findings to a specialist for further examination. So if you are unclear, if you are not sure, it's for me also, I have to refer to a specialist. This is KPJ in Graz. Within a 4 weeks mandatory internship of general medicine, all my students learn to present the standard sections. 4 weeks, and the students are able to see the organs. Not all the pathologists, but they see that they find the organs and they can present these sections. Sonography for the last 40 years. Sonography now is 40 years old, we could say. It started with abdominal sonography, then the protocols raised. You all know FAST, you all know eFAST, POCUS as a kind of sonography focused on questions, especially questions, and then emergency sonography. This Kursbuch, Notfallsonography, is also a compendium of point-of-care sonography. I like this book because it is a small book. You can read it in a reasonable time, and you can all put this experience from the book on the machine. It's very fine. It is point-of-care examination for emergency rooms, outpatient wards, and the general practice, and showing again and again that sonography is an integral part of clinical examination. I have to make advertisement for Staffam, Steirische Akademie für Allgemeinmedizin. Being the chairman of this organization, I have to tell you that every year at our congress, we do this seminar, Notfallsonography. You're invited to come there. If it takes place this year, we are not so sure, but we didn't cancel it yet, but it doesn't look very good. Okay, but Staffam also supplies this point-of-care sonography. There it is called Notfallsonography, but it doesn't mean emergency medicine, it does mean point-of-care sonography. At the end of my lecture, I want to address reservations against the use of sonography in general medicine. General medicine, with its emphasis on communication, conversation, trust, continuity. And we have to ask, could the additional use of technology be an obstacle for the interaction between the patient and the doctor? Too much machines, that's the question. Are they disturbing us? Are they an obstacle? Forget about your worries, considering the history of medicine. 200 years ago, the stethoscope was invented by René Laennec, and there were several medical schools. They put this stethoscope aside, despite the advantages. They saw that there is an advantage of the stethoscope, but they didn't want to use it because they said there is an artificial distance between the doctor and the patient created by the stethoscope and will destroy the natural relationship. We all knew that this is quite opposite. Technology can be a relief because it enables us to talk more about evidences rather than probabilities. If I can talk to my patient and present him evidences of his body's examination, I have a better position to talk to him. Then I have to talk about probabilities. So, sonography-assisted examination is a standard procedure in all the medicine, in all disciplines, and of course I have shown you in general medicine. Furthermore, it is significant for the professional policy of general medicine. There is also necessary to do policy inside the doctors' community. We have to find our place, our position inside the medical community. And for professional policies, it is very useful and very significant. So my last sentence, first in English and then in German, because of the better semantic. Keep up with the times, and times won't pass you by. Oder auf Deutsch, wer nicht mit der Zeit geht, der geht mit der Zeit. Thank you very much. Is there time for questions, or I don't know?
Thank you very much for your lecture. And are there any questions from the audience? Or are there any questions through the live stream? Okay. Well, one question we have for you. What would you say, which organ or organ system do you scan most?
It is the abdomen.
The abdomen?
Yeah.
Okay.
And then very near the chest, lungs.
Okay. All right. Well, thank you very much for your lecture. We have a little present for you.
Thank you very much.
Thank you so much.
Thank you.
Great. And this is also for you.
Thank you very much. Thank you very much.
Thank you. Before we continue, there will be a break until 6:15. And so please just be aware of the corona regulations. Keep your distance, and if you eat or drink something, please do this at your assigned seat. And we'll see you again at 6:15.